Hey, I don't know who needs to hear this, but if you're pregnant and you're at risk for something, just because you're at risk doesn't mean it's going to happen. Did you know that? Let's talk about it. My name is Dawn, and we're going to talk about C-sections, all right? So what are some things that can increase your risk for a cesarean? Oh, you might be having more than one baby, twins, triplets, or more. You could have a high BMI. You might have gestational diabetes. You might have a suspected bigger baby. But did you know other things can put you at risk for that as well? Like your age, like if you're advanced maternal age, right? You're over 35. Your race can actually increase your risk for having a cesarean, and a lot of other things that have nothing medically to do with you. Your education level, your income level, it can be where you live, if you're delivering at a public or private hospital. There are so many things, and a lot of the different things that can increase your risk for having a cesarean are because of provider bias. And you don't have an impact on that, right? So the most important thing I can do as a childbirth educator and labor and delivery nurse is to help empower you by informing you with how does your body work and what are your rights as a patient and how can you advocate for a birth that you want and for medically necessary interventions and not for things that are convenient for the provider or comfortable for the provider, because there are biases. We all have them and we cannot function without our biases. It's impossible to get rid of them. So we have to be aware of them and bring them to the forefront and make sure that when we're taking care of patients, we're taking care of them and what it is they want and what it is they value. What was your experience? Did you have a risk for a cesarean or something else? And you could tell that your provider had biases, or maybe your nurse or somebody else? Let us know how you navigated through all that, right? How did you advocate for yourself and communicate the things that were important to you? Let us know in the comments, and don't forget to like, follow, and share for more.